and thank you for coming to my presentation. My name is Mariah McLean, and I am a student physical therapist assistant at Cockhorn Career College. Today we are going to be talking about multiple sclerosis. Before I begin, I'm going to give you guys some handouts. On the first one, you will see what a normal myelin sheath looks like, and on the bottom, a damaged one. Your second sheet is age ranges and ethnicities. Our learning objectives: what is multiple sclerosis, signs and symptoms, treatments, susceptibility, summary, and then any questions you may have at the end. Have you ever felt tired, off balance, or had blurred vision? Well, these are common symptoms of many ailments. It could be more. What do you know about MS?
I know it's painful,
Okay.
right?
Yes,
Yeah.
that is accurate.
I know it's painful.
Anything else?
Slow progressive disease.
That's true too. Yes. Awesome. Chrissy, do you know anything about MS?
It can happen between the ages of 25 to 50.
Okay. Very good, guys. So, MS is a potentially disabling disease of the brain and the spinal cord, which is also known as the central nervous system. The immune system attacks the protective sheath, myelin, which is on your first sheet, that surrounds the nerves and causes communication problems between the brain and the rest of the body. Over time, permanent damage can deteriorate the nerve fibers. Signs and symptoms. Each patient presents with different signs and symptoms. The severity of each symptom and how long they last differ with each case. One person may suffer from 1 or 2 symptoms, while the next person will suffer from many. Some will go into remission for months, while others will have frequent flare-ups. While relapsing remitting MS symptoms can also resolve and then new symptoms take their place. This can be followed by weeks or even years of remission. They suffer from fatigue, which occurs in about 80% of people. An MS hug, which is a squeezing sensation around the torso that feels like a blood pressure cuff. Walking difficulties, feeling off balance, weakness, and spasticity. Numbness and tingling in face, body, or extremities. Vision blurriness, poor contrast or color vision, and pain with eye movement. They can also suffer from bowel and bladder dysfunction, vertigo and dizziness, cognitive and emotional changes, depression, pain, and itching. Even small increases in body temperature can worsen signs and symptoms, but these are not considered a relapse. Instead, they are considered pseudo-relapse. It is hard to diagnose due to symptoms being similar to many other diseases. Doctors run blood tests to narrow down the possibilities. An MRI of the brain and spine will show a detailed picture. They can then locate if there's any inflammation, damage, or scarring, which is also known as lesions. A spinal tap will provide a small sample of cerebrospinal fluid removed from the spinal canal and analyzed for antibodies that are associated with MS. As of now, the cause of this disease is unknown, but it is known that it is not inherited. Isn't it? Very interesting. Prognosis. There is no cure for MS, although life expectancy is that of a normal person. In some severe cases, though, people may die prematurely from infectious complications due to the disease. Some treatments that they can receive include corticosteroids, such as prednisone, to combat inflammation. They can also do plasma exchange, which is when the patient's plasma is removed from the blood cells. The blood cells are then mixed with a protein solution called albumin and then put back into the patient's body. This method is used when symptoms are new, severe, and not responding to steroids. Relapsing remitting treatments include injectable, oral, and infusion medications. Who is susceptible? Nearly 1 million people are living with MS in the United States as of 2019. Factors include gender, age, genetics, and ethnic background. 3 times more women have MS than men.
Oh, that's
It is more common in the Caucasian population and Black population compared to the Asian or Hispanic populations. Only slightly because you're still a woman. As your chart shows, the age range is most common between 25 to 50 years of age, although it can happen in any age. Obesity, smoking, low vitamin D levels, and having certain autoimmune disorders can also be risk factors. Managing symptoms with diet, exercise, and a good sleep routine can be helpful. Continue collaboration with your primary care, doctor, and rehabilitation team. Vocational rehabilitation to help with continuing their current job or helping them find a new job with accommodation to their needs. Maintain a certain temperature to prevent attacks. Surround yourself with a good support group, and know that this is an ongoing battle, and this care will be continuous.
interesting.
In summary, there is no known cause. Signs and symptoms differ from case to case. Treatments include corticosteroids, plasma exchange, and oral and injectable medications. More women are diagnosed with MS than men. As of now, there is no cure, but they can live a normal lifespan. Now, after hearing about MS, what causes multiple sclerosis?
Is that for everybody?
Anybody who knows?
Oh, I got the answer.
Yes, ma'am.
There are no causes for MS.
Okay, John.
No known. Well, you heard what I said.
Well, it's just
No known. No known.
Thank you for the correction. No
Thank you for
known
correcting
causes.
me. No known causes.
What is the cure for MS?
I got that one. There is no cure.
No known cure.
No
known
known
cure. My bad.
What is the age range for multiple sclerosis?
25 to 50 years.
Good job. And one last question, see if anyone was really paying attention. Name one treatment they can receive.
Oral.
Medication.
Thank you.
Yeah.
Oral medication.
Yes, good job. Are there any questions?
No, ma'am. Very interesting. I learned a lot.
Thank you guys for coming to my presentation, and I hope you guys enjoy the rest of your night.
Thank you, ma'am. Thank you for being so informative and educational.